Thank you. Good afternoon. Thank you very much for the opportunity to be here. I'd like to thank Angela and Joe Clote and all the folks at Missouri Meeting and Planners for allowing me to be here. And let's have a round of applause for this great event they've put on. My lovely wife, Lauren, is joining us today. She's sitting here at this table. We've been married 22 years. And I had a young fellow in my office the other day who asked me what the secret to being married 22 years was. And I said, well, we rarely fight and we don't argue very much. And he said, well, how do you do that? And I said, well, there's basically two rules. And he said, well, what are those? I said, well, I make all the big decisions, she makes all the little decisions. And he kind of looked at me quizzically and he said, does that really work? I said, yeah, there haven't been any big decisions yet. Okay, we're going to talk about health insurance today. I call this Health Insurance 101, how to buy health insurance at a cost you can afford with the benefits that you need. And I'm going to start with probably the most challenged group of people that buy health insurance are the small groups or small businesses. So I'm going to start by talking about those. And I'm talking about the time frame from now until 2014 when the federal mandate dials in and we see the federal and state exchanges in place. So we're going to start by talking about the small groups, and I'm going to start with a very small group, a for-life group. This is an actual case in Wichita. The name of the company is Tiny Tots Furniture. They sell furniture for children, that's what they do. And this group was paying, as you can see, on their previous premium, $1,900 a month with Blue Cross and Blue Shield of Kansas. Now, a little history on these folks. The gentleman's wife who owns the company had a stroke 6 years ago. She takes 3 medications, 2 generics, and Plavix. They were very concerned about trying to move, and if in fact by moving they would lose their coverage or have other problems. A couple of things to keep in mind. When you're moving from one group plan to another, between now and 2014, there are no pre-existing conditions. That's the way that it works when you move from one group to another. And oftentimes, you can carry your deductible forward if it's a mid-year change. This happened to be an anniversary change, not a mid-year change, so that wasn't a problem. But as you can see, he was paying $1,900 a month for 4 people. His concern was, am I going to be able to keep my health insurance? This is costing me a fortune. But he was afraid, because of his wife's stroke and medical conditions, to go out and shop and look for coverage. Probably the single biggest mistake that small business people make and small group employers make is they don't shop their plans. He hadn't shopped this in 6 years, primarily because of the situation with his wife. Well, he submitted applications to us. We took them out and got medically underwritten quotes. Medically underwritten quotes means all the carriers got to see what the medical conditions were. So his wife's condition with the stroke, the medications that she took, that was all factored into the quotes that we got back from the insurance carriers. Of all the carriers we looked at, Coventry PHS in Wichita turned out to be the most effective. And he had an array of different plans to look at, but the one that he chose was a $5,000 deductible HSA. Now, when you look at the bottom line down here, he saved an annual savings of $11,988 by changing to this policy. But you must ask yourself the question, what did he give up? He went from a $3,000 deductible to a $5,000 deductible. So he had a $2,000 swing in there, an additional cost that would be out of pocket for him if, in fact, he were to hit those deductibles. Well, another way to look at that is this. What he was really doing was he was paying $11,988 to the insurance carrier to buy $2,000 worth of health insurance. Now think about that for a minute. $11,988 to buy $2,000 worth of health insurance. That's a really good deal for the insurance company. It wasn't a particularly good deal for him, but it was a great deal for the insurance company. So when we moved to the $5,000 deductible, what happened? Well, he had some drug coverage with the Blue Cross plan. He had a $500 deductible, and they covered 50% of the med after the deductible. And then he had some doctor office visits covered for primary care physician, and he had his wellness benefits. Now he goes to an HSA, health savings account, and nothing is covered up to the deductible with the exception of his wellness benefits. So now all of his wife's mammograms, pap smears, checkups, physicals, his PSA cancer screens, if they have children on the plan, the immunizations and checkups, all of that's covered on any HSA with no deductible. But what about those prescription drugs we were talking about then? He's going to have to pay for those now. Those are going to come out of pocket. Well, 2 were generic, so he'll spend $4 for each of those generics each month. Plavix is $191.40 a month. That's the retail price. He'll pay the carrier's discounted price, which is $121.40 a month. Well, with almost $12,000, he can buy a lot of Plavix. So what happens here, and unfortunately what happens with a lot of folks when they look at their health insurance plan is they look at that $5,000 deductible and it scares the daylights out of them. But in reality, all he was doing was increasing his deductible by $2,000. And he was putting $12,000 back in his pocket. Now let's look at something. He's got 4 people on the plan, right? So let's say they have a horrible year and all 4 people hit the deductible. All 4 people max out the deductible at $5,000. Well, that's going to total $8,000 difference in actual cost over what he was spending and where he is now, correct? $8,000 difference, that's where he's going to be. He's still going to put back in his pocket almost $3,000 in savings. And what are the chances of that happening? Less than 22% of the people in this country ever hit their deductible in a given year. Less than 22%. But what's the first thing people look at when they buy health insurance? What's the deductible? That's the first thing they look at. The second problem that employers have when they do this kind of plan is, now I've got to go back and sell it to my employees. I've got to convince my employees that this is in their best interest. There are going to be food fights. There's going to be riots in the cafeteria. This is a horrible thing. You're raising my deductible, you horrible employer. Well, let's look at something. One of the first things that I hear when I sit down and talk to a small employer that has this problem is, my employees can't buy health insurance for their dependents. They can't afford it. Look at this premium. They can't afford to pay that. So now by going to this other premium and we lower this premium, what happened here? Now we're in a position where the employees can afford to buy health insurance. So the first thing we tell the employees is, guess what? You can now afford to put your dependents, your spouse, and your children on this plan. Couldn't do it before, you can do it now. The other thing that we find is, in most cases where we have this going on, those people don't even buy health insurance for their families. Oftentimes they have no coverage. The employee's got it because it's covered at work, paid for by the employer, but the spouse and dependent don't have any coverage. So this allows them to put them on the plan. And here's another way to look at this if you're the employer, and we've done this successfully in the past. If the employer goes in and says, we're going to increase the deductible by $2,000, which is what happened here, what if the employer says to the employees, you know what? We're going to pick up the first $1,000 past your previous deductible. So at $3,001, we're going to pay the next $1,000 for you. So now, in essence, all we did, because it goes to $5,000, is we raised your deductible by $1,000. But you've got to get to $4,000, which is being paid by the carrier and being paid by the company before you're ever going to see that happen. So you're already at $3,000. We're going to pick up the next $1,000. That leaves you at the last $1,000 if you get to that deductible. Remember, less than 22% of the people ever hit that. Well, when you do that, what happens? 2 things. One, the employer who's had skin in the game takes a little bigger risk and has some more skin in the game. But the other thing that happens is the employees now have skin in the game. That changes the equation because now the employees have some skin in the game. That's their $1,000 we're talking about. So they then become consumers of health care instead of just walking in with their card and doing whatever they think they need to do, because all they've got to do is we've got to pay a copay and we're done. So that's one solution. And HSAs are not for everybody, so let's go to the next program. And this would be a limited benefit plan. This is kind of an in-between an HSA and the fully insured PPO that covers everything with a copay. And how do these work? Well, this plan that Coventry PHS has in Wichita is called the Super Joe plan. It's kind of a nickname for it. Under the Super Joe plan, their total premium would have been $1,181 a month, and the difference in total savings was $8,628. But look what happened. The deductible is the same. They're currently got a $3,000 co-insurance and deductible combined for their out-of-pocket max of $3,000. On this plan, they would have a flat $3,000 deductible, no co-insurance, so their out-of-pocket is exactly the same here. Yet he's saving $8,628. And what are they getting? Well, on this plan, they do get first dollar doctor visits, all covered. So your regular physician, your pediatrician, and your OBGYN are covered with a copay. You get all your wellness benefits covered, so all of that's covered with a copay. You get all your lab work covered, that's covered with a copay. And you get your urgent care covered, that's covered with the copay. And tier 1 and 2 generic drugs are also covered with a copay. So if the comfort level is a little greater by giving them first dollar coverage, here's an opportunity to do that, and at the same time lower the cost and become better consumers of health care and health insurance.